Bismillahirrahmanirrahim. Thank you, Mr. Chairman. I'd like to thank Dr. Jamal Al-Surur and the organizing committee for inviting me to share with you this a saga that need to be brought to the surface and considered, because if you want to tell me what kind of adjuvant therapy you want to use now with your stimulation cycles, I'll tell you vitamin D. I'll be convincing you soon. So to start with, we all know that vitamin D is the sunshine vitamin. So usually it's absorbed through the skin, and then with the 7-hydroxycholesterol activation, we have the pre-vitamin D3 need to go to the blood, to the liver for the 25-hydroxylation, and then through the kidney for the 125 dihydroxylation. In fact, through the 1-alpha hydroxylase. This is the time when it becomes an active vitamin D that really works on the tissues. And as you can see, you need to have the vitamin D receptors, the VDR, on the tissues. And these are all the tissues here, maybe you can see it or not, but including placenta, ovaries, even like the testicles in men, and so on the endometrium. And that's why we see that the vitamin D receptors are widely spread in our body, and especially in women, and it has a purpose. Even if you talk about the alpha hydroxylase present in the kidney, the other side of alpha hydroxylase is the placenta. And why? Because we want to deliver more vitamin D for the baby and for the fetus, and there are other reasons for that purpose. So what we're talking about here is the level of vitamin D, and this is a very important subject that we all know. We all know that the vitamin D is the vitamin that we really work for the bone and for the muscles, and that was considered as deficiency leading to rickets, to bone problems. But when we talk about other benefits of vitamin D, which is what we call the non-bone health, benefits of vitamin D, and here we're talking about, for example, working for the insulin resistance, working for the diabetes and all that. And for that purpose, we have seen evidence to show that for the reason of bone health, you only need to have a 30 nanogram per ml level. But in order to get the benefit of the non-bone health of vitamin D, you have to have a 60 nanogram per ml level in your system to get that benefit. So here we start to differentiate between the two benefits of vitamin D in order to give you the bone and versus the non-bone health. Now, when it comes to reproductive function, vitamin D receptors are located, as I mentioned before, in all our reproductive organs. Vitamin D plays a crucial role in ovarian reserve, steroidogenesis, and follicular development. Vitamin D enhances the sperm function, and it has an anti-inflammatory. It's a very strong immunomodulator. Believe it or not, it has a property of regulating the cytokines expression, which is essential for maintaining the favorable reproductive environment. Here is the hoxatin. We all know that it is one of the most important genes required for maintaining the endometrial receptivity. And an endometrial receptivity marks the hoxatin has been really involved in the embryo implantation, and although the expression of hoxatin leads to impaired endometrial receptivity and failure of the embryo implantation. The active vitamin D, 125 dihydroxy vitamin D, increases the hoxatin messenger RNA and protein manifestations in human endometrial stromal cells. Therefore, the interaction between the sex steroid hormones and vitamin D may regulate the hoxatin, implicating the role of vitamin D during the peri-implantation period. Vitamin D the M complex with the receptors activates various transcription within the cells that will really regulate the hypoxia included in the 1-alpha signaling for promoting the endothelialization as well as the angiogenesis within the endometrium to maintain implantation. So, vitamin D enhances female fertility through hormone regulation, endometrial receptivity, IVF success, PCOS treatment, miscarriage, as well as egg quality. And if you take all these 6 factors, you'll find vitamin D has a role in each of them. I don't have much time here, but at least let's talk about it in general. There are important considerations I have to mention, which is the correlation and the causation. I mean, we have seen many studies that say, okay, we have really seen low levels of vitamin D in cases who had miscarriages. I mean, where does it work? Is it the cause of the miscarriage? That's an area that needs to be worked on in order to evaluate or even to make the causation problem. Vitamin D ameliorates diseases, okay, that has fertility link. For example, we have seen that PCOS, endometriosis, fibroids, recurrent miscarriage all cause infertility. And now we have seen vitamin D working in each one of those. I mean, if you talk about PCOS, yes, there are all PCOS patients have a low level of vitamin D. And if you give them vitamin D, you can see, you know that high LH, it will go down. You know that miscarriage rate will go down. So it has been shown that the vitamin D works better with PCOS patients. The same goes for endometriosis. And for that, we have seen from human clinical trials that vitamin D supplementation improved the reproductive outcome for those infertile patients, while others may be failed. But I'll tell you, accumulating evidence now from the prospective random cohort observation studies propose that vitamin D insufficiency or deficiency was related to the fertility. So, when we talk about the vitamin supplementation prior to IVF, this is very, really narrow area that I want to touch in clearly. I mean, giving vitamin D before your stimulation cycle, would that improve your outcome? Here it is. Since we still need to improve our areas, everybody say, well, I'd like to have better results in my lab. I'll tell him to give vitamin D. So why? Because it is proposed that vitamin D status might influence the initial embryo implantation by regulating the immunological cells, as well which is like natural killer cells, the dendritic cells, and so the macrophages. It's a very, very important immunomodulator in that area, in the decidua and the uterine tissues. So, for this, I found a very beautiful study. I mean, if you want to read about it, I mean, go to the study and you'll learn about vitamin D and its role in your IVF cycles. It's a systematic review of 12 studies. 9 of them are RCTs and 3 are cohort studies. And from this, we have looked at the effect of vitamin D supplementation prior to IVF. First of all, they found that the clinical pregnancy rate was increased in those who supplemented with the vitamin D, but the miscarriage rate and the multiple pregnancy rate was the same in both groups. Now, when we noticed there was the heterogeneity, because these are multiple studies, so they have looked at the outcome. Now, when we said the CPR, the clinical pregnancy rate, was increased with a P of value which is about P001, but the heterogeneity is 63% because of the variability of the studies. However, the implantation rate and the biochemical pregnancy rate was not changed between the study group and the control group. Again, you can see the heterogeneity there is 85 and 63. So what they did, what they called the sensitivity analysis. They look at what is the study that really can make a difference. So Meliana, which is an Italian study from 2021 published in the American College Journal, have a remarkable effect when it was removed, and this heterogeneity in the data reduced from 63% to only 36%. So why? Because this guy, in his study, he was giving 600,000 of vitamin D once before the stimulation. So it's really odd, and that's why when we removed that study, we found that, yes, there was maintaining the efficacy for improving the clinical pregnancy rate, for improving also the biochemical post-pregnancy test and the implantation rate. So here we can see that with this, we can see the improvement once we took that study out. Now, in addition, we have looked at the level of the vitamin D prior to the study, and you can see that those who had actually at the level of 30 or below 30, maybe they have better pregnancy rate after taking the vitamin D, but not those who had very, very low. So that's one point to consider. And then what about the different drug types? We have seen that the vitamin D was given in different studies, either as part of a compound, which including the vitamin D plus Q10 and other stuff, or vitamin D alone. And we have seen that those who have received the vitamin D, whether it's in compound or not, have the same outcome, and with improved clinical pregnancy rate. Then what about the total dosage? So compared with the control group, the clinical pregnancy rate was increased significantly in the case group when the infertile patients were treated with 10,000 to 50,000 or 50,000 to 500,000 during the duration period. So again, we have seen that in this study, there was no difference or improvement in the clinical pregnancy rate if the total vitamin D dosage was lower than 10,000 IU or higher than the 500,000, like what that gentleman gave in Italy. So these are, it's a very delicate balance, and you have to keep that in mind. Now, again, what about the duration, actually, here of the vitamin dose? So he found that the significance of clinical pregnancy rate was improved, actually, in those who had taken the vitamin D for 30 to 60 or 60 to 89 days. But those who received the vitamin D for less than a month prior to the stimulation cycle, they did not benefit. You see? So there is always some kind of effect there, and monitoring the dosing and the duration. Frequencies, giving it daily, weekly, or even once a month. Again, here shows the effect was seen when it was given on a daily or weekly basis. If you just give it once, like the Manila study, it did not show an effect. Again, you have to keep that in mind when you supplement with vitamin D prior to your IVF cycle. The daily, actually, dosage also. What's the acceptable range to give you a benefit with improved clinical pregnancy rate? It shows here range between 1,000 to 10,000 daily clinical pregnancy rate was improved, and you can see the heterogeneity even only 0. However, no significant difference with the daily dosage vitamin D supplementation if it is lower than 1,000 or actually higher than 10,000 per day. So here at NAIN, it gives you a guidance how much you give your dosage per week or per day and at this level. So I'd like to conclude, ladies and gentlemen, from this, that vitamin D deficiency is a serious health deviation that can affect female reproductive performance in terms of miscarriage, infertility, ART success, and also progression of fertility-linked diseases such as the PCOS, fibroids, and endometriosis. Vitamin D supplementation is the only answer. And thank you very much.